A lot of the patients were not receiving the education related to the potential side effects of the therapy. And yes, were they receiving the consent, and did it include the side effects of therapy? Yes, it did. So they did have that. Did they understand it? No, they didn't. So as with many other specialties, nursing is the one that sits down and breaks it down for them. Coupled with that was the continuum. Like, how do I get from saying, hey, I'm eligible for this and I want to do this, to actually getting the therapy. So it's quite a long road, and that was somewhere else that they needed quite a bit of help with. We created a folder, we made it bright red, something consistent. We asked them to take it to all of their appointments, so that way anybody that they met with could add information to it. For the early patients, we hadn't required a caregiver. And then when we looked at the big picture, we said, well, this is no different than any other transplant that we do, or even chemotherapy. We require them to have a caregiver. We're giving outpatient chemotherapy and sending them home to a local, well, not home, but to local lodging by themselves. So we incorporated that. We added quite a bit into the folder as far as the CNS toxicities, the neurotoxicities, tumor lysis syndrome, just the side effects of chemotherapy in general, at-home chemotherapy precautions, the calendar that shows them the flow, and then for the post follow-up, again, just neutropenic precautions and so on and so forth.